Horizon TV, the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Ni Alhamisi nyingine tena, 12 la mwezi mtukufu wa Ramadhan. Alhamdulillah for the life that Allah has given us. Welcome to another Ramadhan Synchronized show. Kipindi hewani ni Siha ya Ramadhani, nami wako Mariam Mwacharo. Kama kawaida, unajua katika kipindi hiki sisi hupania kuboresha afya yako wewe mtazamaji wetu mpendwa. Now, welcome to Ramadhan Synchronized Siha ya Ramadhani. As usual, we'll be speaking both English and Swahili languages on this show. Kama uko comfortable with whatever language, do feel free to contribute to the topic of discussion today. We are talking about cholera and sanitation on our social media platforms, Facebook, Twitter, Instagram, at HorizonTv Kenya. Na vile vile unaweza kututumia arafa kupitia nambari iliyoko kwenye screen zako kwa sasa, 2195121951. We'll be opening our call lines, or rather opening them on the second segment of our show. Now, as I've gone ahead and told you, we'll be talking about cholera. We've had cholera with us worldwide since the 400 BC that started in the Ganges River in the Delta. 1829, the world was still battling cholera according to World Vision 1961, 2010, 2016, 2017, and in 2019, just recently in Mozambique by the cyclone Idai this March. Recently, we also had an outbreak of cholera in our country, here in the county of Nairobi. With me to discuss this topic is Dr. Nasra Ali from the Nairobi Hospital, who's a medical officer. We also have the Deputy Director for Public Health, Nairobi County, who is also the head of disease investigation, in Nairobi County, Mr. Raphael Muli. Thank you so much for gracing our show. Now, as I've told you, we'll be talking about cholera and sanitation. As just we prepare to delve into this topic, let me have my producer and director, Muhammad Shakombo, have an introductory video on our screens on cholera.
Cholera is a bacterial infection that causes dehydration and can be fatal within hours if untreated. The disease started spreading worldwide since the 19th century and is now endemic in many countries, particularly in Africa, Asia, and Latin America. Countries facing humanitarian crises such as conflict, extreme poverty, and natural disasters are particularly vulnerable to cholera outbreaks due to the lack of access to clean water and proper sanitation. Infection is spread through drinking water or eating food that is infected by the cholera bacterium. The source is usually the feces of an infected person. Cholera then spreads from person to person across counties and counties through travel and contact by infected person. Most people infected by cholera don't develop any symptoms, but the pathogens can stay in their feces for over a week, which means it's contagious where sanitation is poor.
Jib. Now, welcome back to our show. As we've had that introductory video by my producer director there, Muhammad Shakombo, we've all seen it. Karibuni tena katika show yetu. Now, if I may start with you, Dr. Nasra. We've had an introductory video about what cholera is. We know that it's a bacterial infection. But what don't we know what cholera is? Is it just a bacterial infection?
It's a bacterial infection that primarily affects the gut.
Okay.
So there are two parts of your gut, your large intestines and your small intestine. Primarily affects the large intestine. In the large intestine, where the water is supposed to be absorbed and food is supposed to be absorbed. When this part is affected, actually, if you've consumed or you've been in contact with someone who has cholera, then within 2 to 5 days, you can start exhibiting the symptoms.
Okay.
Yes.
So how does cholera, what are these symptoms of cholera?
The major one is watery diarrhea. So having a lot stool motions that are very, very extremely watery. And also vomiting. So in those kind of patients, getting into severe dehydration is very common. That's why you find that a person would go maybe 8, 9, 10 times within a couple of hours, and then they would start feeling weak, they start feeling dizzy, they start feeling thirsty. It's because they've gone on to becoming dehydrated. Yes.
Maybe is there anything else to add, Mr. Deputy Director for Public Health, how cholera maybe has been showing itself in people?
Well, thank you. I think Dr. has mentioned it all. The only thing that I think I need to emphasize, it's cholera is a dirty man's disease. It's a disease also called fecal-oral. You must have ingested some bacteria that have come from fecal matter. And that is how people get the disease. Like Dr. has just pointed out, that married quite a number of symptoms. People will start, having diarrhea. And for this particular diarrhea, it is what we call effortless. Effortless means it will come out, you like it or not. There's no control of your muscles to contain it, so it just passes out. And then the people who also have vomiting, there are people who might not have vomiting. But the cardinal sign of the sign is that watery diarrhea that is effortless. Then it also, there's a typical color of that diarrhea. It looks like rice water, the way you prepare, as you prepare rice, as you wash it, there's that whitish kind of a color. That is the typical kind of diarrhea that you'll get from this disease.
Yeah, so as we have seen throughout history, we've had cholera for so long. We've had it since, I hear that here in Kenya, it started in 1971. It's been all over the news. Let me just put your concentration on our screens over there. Let's see how much the news has covered cholera all through history. If I can have my director there, Muhammad Shakombo, just show us to you how much cholera has been there in our news today. Let's have a look, Shakombo.
Romina Abakar Arden has cholera and she's severely dehydrated.
Horizon TV, the beacon for the nation.
Katika eneo la Moyale, mkoa wa Kaskazini Mashariki. Nyuso zilizodhoofika kutokana na maradhi ya kipindupindu pamoja na magonjwa mengine ya kuharisha na kutapika.
Admitted due to cholera at the Nairobi hospital has risen with 30 members of staff, among them doctors and nurses, hospitalized.
Let's cross over to Nyeri, where the county government has banned food hawking and ordered for inspection of food courts and hotels after an outbreak of cholera.
One person has been reported dead while 7 others are in critical condition following an outbreak of cholera at the Nairobi hospital.
Six people have been confirmed dead following the cholera outbreak that has affected Kenya since the beginning of the year.
The cholera emergence has been reported in the counties of Turkana, Baringo, West Pokot, Isiolo, Kilifi, Kisumu and Tana River.
As you can see there, it's been all over the news since time immemorial, since history. What is happening to cholera, if I may ask you, Bwana Deputy Director? Is cholera wearing different coats on us? Is it pretending to be something else?
Well, let me start by saying this, that cholera is about dirty environment, it's about poor sanitation, it's about people not practicing good hygiene practices, and that is how people get contaminated of the disease. So if cholera is wearing a different hat, I do not think so. We are still having the same cholera that we used to have many years ago. It's only that our practices as individuals, our practices as a country are wanting. One of the biggest challenges that we are having is we ourselves as an individual, what precautions do you take to ensure that you protect yourself from some of these fecal-oral related diseases? And basically what we advise or we ask people to do is to take personal precaution. There are some hygiene practices as an individual that you're supposed to take. For example, basic things like washing our hands. And I'm just not talking about just washing hands. Many times you have a practice where people just touch water and believe they have washed. I think that is not right. People need to take time, and especially as you wash hands, and we recommend that as you wash your hands, wash with soap and take your time and wash your hands thoroughly, because many a times in our African setup we prefer eating with hands, and that is cultural in every community in Kenya. But how safe are your hands as you eat that food? Yeah, let me just cut you right short there. We'll come back to, you know, what measures we need to take, how we need to properly wash our hands. We did have a chance to meet Professor Karama earlier before the show. Professor Karama, who is also heading research of tropical diseases. He's also the author of the 2012 to 2018 Protective, you know, Forum. He wrote a whole PDF of how the government, or rather the country, can come to protect itself from cholera. Let me just have Shakombo there have the video of Mr. Karama earlier when we were speaking. I'm joined with Professor Karama, who specializes in research of tropical diseases. Karibu sana, Professor.
My name is Muhammad Karama, currently the Deputy Vice Chancellor of my university. Now.
Yeah, so I know that you specialize in research of tropical diseases, and today we're talking about cholera. Cholera, as per research, I've seen that it's been here for so long. Where did cholera start?
Cholera has history. The first episode of cholera that is documented in history started in Southeast Asia, India, and over the period in history, there has been several waves of cholera outbreaks. The first wave started the last century, and then we continue having different waves of the cholera outbreaks. That there was outbreaks of this disease in Southeast Asia, in parts of India, and then in parts of Africa as well. For example, in Kenya, the first episode of cholera outbreak that has been documented was in 1971. And unfortunately, it occurred in the Turkana district, in the northern part of Kenya. And we could not trace the index. In other words, when cholera attacks, you have to find the source of infection. So we related this to the wave, to the global wave of cholera outbreaks. And then we've had several outbreaks thereafter.
Okay. So now that there have been all these outbreaks through history, what is happening to cholera? Because I believe cholera can be treated very easily, and yet we still have people dying from cholera since 1970 in Kenya. What's happening? Is cholera changing? Why can't cholera just die?
Cholera is a very easy disease to treat, and it can kill very fast also. It's really a shame in a country like Kenya, where we've had independence for close to 60 years now, and that means the quality of life is going down. In the past, cholera attacked the low-income areas of the society, but currently cholera is attacking the high-class areas of our country, big hotels, big places. So cholera is likely to be there to stay unless we change our attitudes toward cholera.
And how do we do that?
Education of the masses. When you tell people cholera is a bacteria, is a germ, they don't understand, they don't see the germ. Why is cholera easy to treat? Because cholera does not affect people through any other method other than what you put in your mouth. So it is easy to treat. It is easy to prevent it. It's easy to control it if we choose what we put in our mouth. It's not sexually transmitted, it is not contact transmitted, so it's very easy to manage cholera.
Okay.
So the best way is to educate the people to improve their hygiene standards. For example, you might be surprised to know that the number of people who wash their hands after going to the toilet in Kenya is less than 15%. Majority of the people, they don't wash their hands. So those who are in contact with feces, or they touch their whatever, and they can easily contaminate themselves. So one of the reasons why cholera stays is because that people don't know so much, that even if they know, they don't change their behavior. If we concentrated on improving our hygiene standards, so even these cases, asymptomatic cases and others, would not be an issue at all. But unfortunately, that is not happening. The other issue is what we call nosocomial infections. Nosocomial infections are infections that people pick in the hospital. You went with another disease, you pick another disease. Because cholera is highly infectious, many people, when there is an outbreak and then we put the patients together and we put them in a hospital, then they pick the infection there. We need to have a cholera center immediately we have an outbreak, so that you can now put maximum management of hygiene, infection control, sterilization, and so on. That is very crucial in management of cases.
Oh, thank you very much, Professor Karama. That was a very good insight from your side. Back to studio, let's go on with this topic. That was Professor Karama. As you've heard him, he talked about how overcrowded some of our medical centers are, and that he also proposed that we put medical centers aside just to address cholera centers. He was the person behind the authorship of the proposed criteria of how to prevent cholera in the country 2012 to 2018. Now remember, you can contribute to this topic on cholera and sanitation katika social media platforms zetu, Facebook, Instagram and Twitter at HorizonTv Kenya, na vile vile unaweza kutuma arafa zako kupitia nambari iliyoko kwenye skrini yako 21951. Uliza swali langu kwako mtazamaji, unafanya mbinu gani kuweza kuhakikisha kwamba mazingira yako kwa nyumbani ni safi na maji unayotumia pale nyumbani ni safi? Nasubiri majibu yako. Pengine tukirejea kwenu daktari na bwana deputy director, niulize, tutachukua mapumziko tu mafupi, lakini pengine kwako bwana director, county inafanya nini ili kuweza kuhamasisha watu nje kuhusiana na cholera?
Asante Mariam. Tumeweza kuambia watu kupitia runinga, kupitia redio, kuhamasisha watu kuhusu hii ugonjwa wa cholera. Njia ya kwanza ile ambayo iko na impact kubwa ni njia ya kuambia watu jinsi ya kujizuia na hii ugonjwa, na vile county imefanya, tumeenda vijijini, tumeenda karibu kila sub county tukiwaeleza watu vile wanaweza kujizuia. Njia nyingine pia tumeweza kupeleka zile tunaita posters katika maeneo mbalimbali, hospitalini, huko vijijini, ndio watu waweze kusoma na kupata hiyo ni ugonjwa gani. Njia zingine pia tumeweza kuwaeleza watu kuhusu maji ambayo wanayotumia katika nyumba zao. Najua Nairobi tuko na shida ya maji, kuna ile tunaita upungufu wa maji na kuna water rationing. Na watu wengi huenda ununua maji kutoka watu ambao wanazitembeza mitaani. So tunaambia watu aujue hiyo maji imetoka wapi. Ni vizuri kuwa hiyo maji ukipata ile inatumiwa kunywa, una boil alafu kisha pia unaweza weka aquatab ama njia yote ya kuhakikisha hiyo maji iko safi.
Bwana Deputy Director, samahani, tutakatiza tu kidogo, acha tuchukue mapumziko mafupi. Tutakaporejea tutarejea katika njia ambazo tutaweza kutumia maji katika njia sawa, how you can preserve your water, your food. We'll come and talk about food. Please, let's take a break. When we come back, our lines will be open for you to make calls, ask questions about cholera, sanitation around your home, what you can do as a community, and we'll be getting back to you with them. See you in a bit.
Horizon TV, the beacon for the nation.
Assalamu alaikum warahmatullahi wabarakatuh. We are now at the Arena 1. Wait, you just stand there. And over here we have player of the day.
I'm back to beat Hamza's team.
He's a diver.
I chose Surah Al-Mutaffifin. I don't know the names, but Nabi Isa said, I am a slave of Allah. Is it Prophet Luqman?
1 point for this team.
Welcome to Active Sunday.
Things which will happen at the last day, which is very shocking. That's not fair because I wasn't here.
It's a happy, happy, happy day. Oh, what a happy day it is for Active Sunday.
Horizon TV, the beacon for the nation.
Assalamu alaikum warahmatullahi wabarakatuh. Karibu tena katika segment ya pili ya kipindi chetu Ramadhan Synchronized, Siha Ya Ramadhani. Nami wako Mariam Mwacharo. If you're just joining us, we're talking about cholera and sanitation. We know that cholera has been with us since time immemorial. We have been battling cholera here in Kenya specifically since 1970. According to WHO, 42,000 to 142,000 lives are lost by cholera each year. Now, before we took a break, we were talking to Deputy Director about cleanliness za mikono, kuosha mikono na nini vile ambavyo ulikuwa ukiambia unaambia jamii huko nje how to wash their hands. Please, let's continue with that.
Yes, Mariam was saying there are basic, very basic innovations to ensuring that we don't get some of these diseases. And the very most basic intervention is cleanliness. Cleanliness, hygiene are one of the very basic principles of controlling many diseases, including cholera itself. So what we are telling people is it starts with you as an individual, that you ensure that you practice safe hygiene practices. And there's some steps or areas you need to observe to ensure that you maintain some hygiene practices. One is after visiting the toilet. It is important that you wash your hands and wash your hands thoroughly with soap and running water. Secondly, it is important that before eating any food, you should ensure that you have your hands are also cleaned. And I said about issues of cleaning, washing your hands, there are people who take it so casually. I think it is an art that people need to learn on how to do it. And I think in the process we'll be able to demonstrate on how to ensure that that is done. So before eating, it's important. For mothers who are taking care of their children, after changing the child's diapers, many a times we have this notion of the child's feces do not contain any bacteria. That is a wrong perception. It does contain. So after changing the child's diaper, it's important also to ensure that you take the precaution. I have always said when we mingle, we have a culture of greeting each other, and that is very cultural. And I'm not saying it's bad, but after greeting, before you take a meal, because like the professor who is my mentor has just mentioned, before ingesting anything, please ensure that you have taken proper precaution to wash your hands and ensure that whatever is getting into your mouth is equally from a reliable source. Yes.
Dr. if I may come to you. In fact, I just saw a question before we went to the break. There's a lady who's asking on Facebook here, how do I make sure my hands are clean? How do I wash my hands? Kwa sababu mara nyingi nikiambia watoto wangu waoshe mikono, they just put their hands in the tap and then they get them out. Dr. if you can tell us as a medical professional, how do we do it?
So washing your hands, you have to use water and soap.
All the time?
All the time. So when you put some soap, first you lather your hands.
Okay.
Then the first part you want to do is the roof of the hand.
Okay.
So like that on both hands. And then after that, you do like that.
Okay.
So you're taking care of the palm and in between your fingers. And then the other step is rubbing. So with the rubbing part, first you rub like this, then your thumb, and make sure you do both sides at each time. And then after that, the tips of your fingers, and then after that, up to here.
Okay.
So after you get out of the toilet, like before you eat your food, after you've washed, like Raphael, the way you said, after washing the baby's bottom. And every single time you're going to be in contact with any kind of food products, you make sure that you wash your hands like that. Even moving from meat products to vegetable products, wash your hands again. And then
so when you're in the kitchen and you're preparing food, you cut your meat, you have to wash your hands first before you cut veggies.
Exactly.
Okay.
And then because the bacteria that's there in the meat will survive in the vegetables. And ideally, your board that you're going to use to cut up your meat or your fish has to be different. So if you're cutting up red meat, after you finish, take that board, most of us use the wooden one, you wash it off, soap and water, and then use it for the fish, and then use it, wash it off, and then for the chicken, because they all have different bacteria that can live within it. And then the same with the vegetables. Vegetables and fruits will all be cut together. That's perfectly fine.
Okay.
Yes.
So there's someone asking, what if I use sterilized wet wipes if I'm washing my hands? Maybe I think that's what they mean. There's this sanitized wet wipes. Can you use that to just rub on your hands and then you begin eating, or maybe after when you're changing the baby?
No.
No?
Because ideally the transmission transmission of cholera is fecal oral. So from particles of stool to your mouth. So you have to wash your hands. There's no way around it. So if you're going to handle any kind of food product, anything that's going to go in your mouth, even when you're feeding your baby, you have to wash your hands, because automatically that's food you're picking up and then putting into another person's mouth. Yeah, sanitizing maybe during the day when you use it, but not before handling food.
Not before handling food.
No.
Yeah, that's also, and there's another question here from Salim Lee. Okay, Salim from Facebook. He's asking, how do we wash our hands? Is it necessarily on running water, or I can wash in a basin where it goes? That culture of taking the basin round before eating. Yes, so how is it, how do we wash our hands appropriately?
So after you've done the 7 steps, you put your hands under running water, because imagine if there is fecal matter and then someone else uses it to clean, that means you've contaminated the next person's hand. No, after you've used all that steps, running water.
Okay.
Yeah, that's the best way to do it. Yeah.
Back to you, Bwana Deputy Director. Of course, definitely sasa vile ambavyo tumejua cholera comes from fecal to, you know, to the mouth. Definitely these feces find their ways into our water reservoirs, yeah? How? Is it through rain? How?
One of the things that we've mentioned, one, let me start with how does it, the reservoir. One of the things is about after defecation. When you leave the fecal matter not properly disposed, that can be a source of contamination. Either rain will rain, and after it rains, if that water has that fecal matter has the bacteria, then it will be washed to the nearby river, and definitely that bacteria will thrive, and somebody else might pick and drink that water. Secondly, the person himself might defecate and probably not take precaution by not washing hands, and probably becomes a source of transmission to other people, and contamination of food and contamination of water. So what we are advocating for is ensuring that there is safe disposal of fecal matter. Okay? Then after defecating, there is proper precautions taken, and those precautions are proper washing of hands. Like my colleague has just said, it is important. It is very true. We have a practice where people, you know, just dip their hands. People do this and they believe that is okay, and they'll start eating. I think it's common practice that you wash your hands under running water, so that you wash away the bacteria, because when you do that, like she rightly said, you'll be the first person will have washed probably, and the other thing that we need also to mention is ensuring that you wash with soap, because many a times when you wash with soap with only water, it does not clean. But when you take soap and now clean, You'll even see the data.
Yes,
Yes, so that is the difference. So it is important that you wash your hands with soap and under running water, not taking it around. Back to your question regarding the contamination. Now, one of the things that is fueling cholera in our country here and in our county here is one of the informal settlements. We know that people, there's no sewer system in some of our informal system, and people use what we call pit latrines. And you'll find one pit latrine being shared by 10, 15 families. That can be another source of, if the sanitation inside the toilet is not maintained, then you can be able also to pick at that point, because there is always touch of the walls, touch of the door, and you can be able to pick the bacteria from that point. So there are quite a number of factors that can contribute to this. The other thing that I will also want to mention is about the water infrastructure. You are aware that we have been having quite a number of sewer bursts. One thing that it's important to note is that our sewer system is operating at full throttle, and that is why we have been having quite a number of sewer bursts in most of the estates. High possibility of contamination of underground water pipes that are ferrying water to individual houses. So that is why we are telling people also ensure that whatever water that you take from the tap, it's important that you take another step and ensure that you take another step of treating that water either through boiling or through use of chlorine tablets.
Just before we continue, there's somebody here who sent us a text and she says, Assalamu alaikum, walaikum salam. Mimi naona kuna umuhimu wa kupeleka mafunzo juu ya janga la cholera vijijini ambako hakuna maji safi wala elimu kwa wengi walio illiterate. County should be serious because people are unaware. Madam Kula from Mombasa. Okay, so how do we control, you know, she says, how do we control it? So she's saying that county is unaware of these sanitary measures that we should take. Possibly you could tell us maybe what programs do you have for hivi vijijini as she's talking about here?
What we are doing and what is being done across the country is what you're calling health promotion. Health promotion is passing information on cholera prevention to the masses or to the public. And this has been done. And you can attest that the government has gone full throttle in passing messages through media, both of radio and television, just to make people aware. But apparently, I think we also have a culture of people who listen, who get the message, but they don't act. Okay, people will hear that we're having this situation, please protect yourself, but it just gets into deaf ears and people do not take the precautions. So what we're telling Kenyans, we have cholera is an easy disease to control and contain. But if we continue having practices that are wanting, if we continue having practices that are unhealthy, then we will not stop the cholera transmission. So I started by saying it starts with you as an individual. You need to take precaution of your hygiene, and I spoke about hygiene. There's some very things that are very basic, like for example, cutting of your nails. It is cutting of nails does not cost much. So keeping low lays, ensuring that you practice good hygiene practices will ensure that we break the cycle of cholera transmission.
Maybe if you can tell us some of the statistics that we already have in the county right now. I do have a little bit of the statistics that we actually got in 2017. If we can have a look at our screens right now, my director Muhammad Chakomoda. Yeah, so from January all the way June, August, these are the cases of cholera that were affecting in our country 2017 here in Kenya. What are the statistics looking like now?
Right now we have the counties that are currently having cholera are 4. I think we had 6, 7, and they're going down. We still have quite a number of active transmission in 4 of the counties. Nairobi is one of them, Machakos is one of them, Kajiado is the other county that is having active transmission. And I would want to speak for Nairobi. Nairobi, as we speak, as of today, we have 86 confirmed cases of cholera through culture. Those are the ones that have turned positive. Apparently, but we also have a line list of 610 These are people that have been managed in different facilities, both public and private, 610. And these are people who have come. Some of the cases, we don't have to test every case. As long as a case comes and meets the case definition of that disease, then you are able to treat that patient. You don't have to take a sample for verification. So that is what you're doing. So basically for Nairobi, but for the entire country, I got the weekly CITREP yesterday, but I cannot remember the number. But I know there are close to 2,000 cases since this particular year started.
Yeah, so these are the people we need to talk to. These are the communities that we need to talk to. Mtazamaji, kama unatupata kwa sasa, tunazungumzia kipindupindu na usafi katika mazingira ya kwako nyumbani na usafi wa chakula chako. Swali kwako mtazamaji ni, wewe unafanya mbinu gani kuweza kuhakikisha kwamba nyumbani kwako ni pasafi na chakula unachokula pia ni kisafi? Tuma arafa, piga simu, uliza maswali kuhusiana na kipindupindu o cholera and sanitation na usafi, na tutaweza kukujibu. Daktari, pengine nikija kwako. Right now, it's the holy month of Ramadan. Yes. Muslims, we eat together, we eat out. How are we supposed to ascertain, you know, most people go out to mosques, masjids, you know, they break their fast there. When you see something like maybe restaurant food, let me have my producer there, Muhammad Shakombo, have a look at some pictures of restaurant food there. You see something like that on your table, or the next meal over there, maybe some spaghetti meatballs on your table, and you're very happy with your meal. Some of us who do not make it to such luxurious restaurants, tuala kwa kina mama ntili, let's have a look. These are the situations that we usually encounter. This one, another example just coming at your screen. Okay. Yeah, so mama ntilie kama vile. How do we ascertain that we are eating healthy, that we are in sanitary good conditions for our own health, especially right now, vile kuna outbreak ya cholera?
Ideally, food that is cooked and it's eaten hot is safe. So food that is raw, like vegetables or fruits that are just chopped, that's not necessarily safe because you are not really sure if the bacteria is dead or not. So the bacteria, once your food is prepared and they serve you hot food, that's good. If you're being served food that is cold, then that should give you a concern. Because anything that is prepared anywhere, it only depends on hygiene. So with that person who's preparing it, before they prepared the food and they went to the toilet, they washed their hands, they washed actually not just washing, but washing with clean water. So making sure that the water is not contaminated is also important. So everything they use to wash everywhere, even brushing your teeth with clean water is very important. So the basin that they're going to use or anything that they're going to use throughout the entire process of preparing the food is cooked with clean water, then that would be a clean place ideally to eat. Any fruits, any vegetables that are raw, advisable not to eat out unless you're preparing it yourself because you know for sure that you're making it in a clean environment. But when you're eating out, it's not necessarily advised. Everything else should be thoroughly cooked.
Okay.
So having half cooked, raw, medium rare, not advised. All the way cooked.
Okay. Yeah. So kumbuka mtazamaji, unapokwenda nje unakula chakula, hakikisha chakula chako kimepikwa cooked, yeah? Yes. Fully cooked, not half cooked, na kisiwe kibichi, especially for fruits and vegetables kama tulivyoweza kuambiwa na Daktari Nasra sasa hivi. Tuchukue mapumziko mafupi. Kumbuka unaweza kupiga simu uulize maswali kuhusiana na kipindupindu na usafi. Swali kwako wewe mtazamaji, unatumia mbinu gani kuweza kuhakikisha kwamba mazingira ya kwako nyumbani ni masafi na chakula unachopika pia ni kisafi? Piga simu, tuma arafa kupitia nambari 21951 katika runinga yako sasa, na tutaweza kukujibu swali hilo. Tuchukue mapumziko mafupi, tarejea muda usiokuwa mrefu.
Horizon TV, the beacon for the nation.
Karibu tena mtazamaji katika kipindi Ramadhan Synchronised Siha ya Ramadhani, nami wako Mariam Mwacharo. Leo tunazungumzia kipindupindu na usafi wa mazingira na chakula vile vile. We're talking about cholera and sanitation, and if you're just joining us, you're not late. Send in your questions or your queries on our social media platforms, Instagram, Twitter and Facebook at HorizonTv Kenya, and you can also send in your questions on our SMS lines on your TV. Give us a call, ask your questions and we'll be ready to give you responses. Now, kuna swali limeingia. Why is it that when we receive heavy rains, the outbreak is high? Why? Mbinu ni zipi za kukinga hili, because rains will be there forever? Yes.
So, when you're passing stool, it should be 30 meters away from a water source. Okay. And then when you pass the stool, you dig and you bury it. So ideally, I think majority of people are passing stool very close to a water source, or even not digging and burying it. So if 70% of patients are asymptomatic, so you don't have any symptoms, no diarrhea, no vomiting, and then you pass a stool next to a water source, it rains, it washes in. That water source, someone goes, fetches, and goes to drink water from it. So basically, and that's how we get contaminated.
Basically, we should be practicing better hygiene.
Hygiene. It's very important.
Yeah.
I just what Osha said. You know, there's a practice that is very hygienic, and that practice is safe disposal of fecal matter. And if that fecal matter is not disposed of well, then that will be a source if that fecal matter has the bacteria. And that is why we are telling people do not just open defecate. Even, you know, sometimes even a cat would take precaution and dig and ensure that after it has done the business, it covers. So if a cat can be able to do that, I think it's important that we as human beings that have been given more wisdom and more knowledge than animals, we should also be precautious and ensure that after we have done that business, it is properly taken care of, so that it does not become a source of an infection or of a disease. The reason why there is a lot of many cases of cholera when it rains, or an increase or an outbreak, is this undisposed fecal matter in many places is washed away into the water bodies.
Yeah.
And actually, if you are to dispose of your waste and it is not properly disposed, maybe in an open field, the bacteria can be there for a very long time. So when the rain comes, it will wash it to the nearest water body, and those bacteria will find their way into, you know, that source of water, and probably including it might even seep into the shallow wells that we're having, and contamination can come from that point.
That has actually reminded me, back when we were in school in Kiswahili, we used to be told mavi ya kale hayachi kunuka. So you see, bacteria can still continue to live in fecal matter for so long, such that when the rains come, then it's like, yay, and then it goes into the water systems and then we get infected. Somebody has just asked here, how do I know that I have cholera, Daktari?
For patients who are symptomatic, watery diarrhea, it's profuse. You literally cannot hold it. You tend to run to the toilet. You find some people even pass on themselves. Those are the kind of patients who need to find health centers, anywhere to go to get tested, to check for cholera. But before you do that, there's some sachets which are called ORS sachets, which is oral rehydration salts, which people can sip on as they get to the health center, because some people can be maybe a bit too far from a health center, and that you can get it in any health dispensary, even a pharmacy. You can get the oral salts over the counter. So you drink that. It's usually 1 sachet with 1 liter of water. So you just take your 1 liter of water, clean water, you pour it inside, and you just start sipping as you try to get to the health center.
Okay, so you can actually go to the chemist and say, I want some oral rehydration salts.
Yes, and you can get them over the counter.
Maybe Deputy Director for Public Health, labda uweze kutuambia, how many centers so far, because right now we are dealing with an outbreak of cholera, si ndio? So tuko na centers ngapi ambazo tunaweza kuzireach tukiweza kujua, oh my god, I suspect that I have cholera?
Yeah, before I dive into the question of how many centers, I think let me just emphasize on what Dr. has just mentioned about...
how do I know I
yes.
have cholera?
Yes. Anytime when you get diarrhea that does not seem to end in few hours, because cholera can kill you in less than 5 hours.
Yes, yesterday, in fact, there was somebody who died in Wajir.
It will kill you in hours. So if you're having uncontrollable diarrhea, please seek medical attention to the nearest health facility. Do not, the reason why people are dying, we have an habit of self-medicating ourselves. Unaanza kunywa madawa, unaanza kujitibu, and this thing is not stopping. So by the time you get to the hospital, you already have what we call renal failure. Okay, so at that particular point, it becomes very critical for that particular patient. But if you're able to reach the health facility on time, then you're able to be managed very fast and you'll be able to stabilize. Okay, so we are telling people, please do not, now that we are having this outbreak, please do not self-medicate yourself. You're saying utaenda, and the situation is getting worse. You might wait until you start having some of this condition like renal failure and the rest, and then it will be too late by the time you get to the hospital. We have seen patients who have come at the very last stage and we are unable to do anything about it. So that is a patient who wants to be a special kind of treatment. You have to look for referral. In the process of even referral or referring the patient, the patient succumbs. So it is important. You get diarrhea that is uncontrollable, look for the nearest hospital and rush there like yesterday. Don't go over the counter, start buying drugs to medicate yourself. That is something that I'm telling Kenyans not to do, because we've seen cases that have done that. Somebody's in the house, continues taking drugs that has been prescribed by somebody in the chemist, and probably that person in the chemist was not even qualified. So be very cautious and ensure that you go to the hospital. Back to your question on
the centers that are available in the country.
We are having both public and private health facilities that are managing this the disease. For Nairobi, we are having Mama Lucy Hospital, which is managing cases. We have Mbagathi Hospital. We have Rota Satellite that is managing cases as of now. And any other public health facilities within Nairobi can be able to give the necessary basic support to ensure that you stabilize. The other facilities that we are having is Nairobi Hospital, Aga Khan Hospital, Guru Nanak, MP Shah Avenue Hospital. All these hospitals are also managing patients, and if you rush there and you're able to get there early enough, you'll be able to be treated and you'll be safe.
Okay, so we did a little bit of research and we took a look at how you can actually protect yourself from cholera, you know, some of the practices that you can do. Let's just have a look at that video on our screens there. Let me have producer Shakombo, do you have that video?
Some of the ways to prevent cholera infection is by washing your hands before every meal, washing your hands after visiting the toilet, wash and peel fruits and vegetables if possible. Cook food to the right temperatures, serve food hot, cover your food from flies, and boil drinking water for 2 to 3 minutes, or use sterilization tablets to make water safe for use.
So those are some of the ways that we can use to protect ourselves, you know, preventing cholera. What other ways can we use apart from washing your hands before meals, sterilization tablets, you know, chlorine? I know in the beginning, before we came to the program, you were talking about how to preserve water.
Yes.
Yeah.
So storing of water that has been treated, it has to be in a sealed container that is closed. So I really believe though the seal open, it can still get recontaminated. So it's very important to have it in a sealed container. So if you've boiled your water with the sufuria and whatever, once it cools, transfer it to a sealed container. If you don't transfer it to a sealed container in time, it can get contaminated. That water cannot be used.
Okay.
It's very important to do that.
A question. Here I am in the village. I've fetched water in a bucket.
Yes.
How do I make this water safe for me to use?
So there are a few ways. One way, you can boil the water, and then once it boils, wait for 5 minutes, and then you let it cool, you store it. Even while you're letting it cool, cover it. And then another way is by using water guard or the chlorine tablets. Using chlorine tablets is much more better than using the chlorine drops, because you don't really know how measuring can be quite difficult with that. But with the chlorine tablets, a bit more safer for the public. So I would advise the chlorine tablets. And those are the two best ways to do it.
Okay.
Yes.
Mwana Deputy Director nikija kwako, here we are eating at restaurants and everywhere. What is the county doing in order to make sure that the conditions of our restaurants are sanitary? Because sometimes we've eaten at restaurants and the food tastes a little bit, you know, stale, if I can say that. And sometimes we meet cockroaches and rats on our way to restaurants. So what is the county doing in order for them to make sure that we are eating from clean environments?
What the county is doing, thank you for that question. It's a very key question. Now, what the county is doing is routinely we do what we call inspection of all food eateries. And this is done routinely just to ensure that all hotels meet some standards as far as issues of food is concerned. So we have a team of public health officers who visit hotels just to ensure that the establishment meets some standards. The people working in those establishments are medically fit to be able to handle. We also go and also find out the environment where that food is being prepared to ensure that the preparation, the environment is also safe, because you can get contamination from nearby premises and the like. The other thing that we ensure that we look at is the mode of preparation. When I talk about mode of preparation, we want to find out, is raw food separated from cooked food? And are there those precautions? Is food that is being cooked, you know, does it meet the right temperatures? We even go and check the temperatures of food. And then we also are very precautious to ensure that we also educate them on ensuring that they serve food that is hot. One thing that I must have mentioned, or Dr. must have mentioned, is that bacteria cannot survive in a hot environment. It's a very weak bacteria.
Okay.
So it will not survive in hot food.
Okay.
It will die. So, and those are some of the things that we're telling the people providing these services to ensure that they adhere to.
Okay.
And we continue to follow up. Any premises or hotel does not meet this requirement, we close it down until they adhere to this required standards.
So what about the food vendors? Right now, it's a culture, I think, during the month of Ramadan, people lay out food on the streets. So there's buses that pass by, you know, dust and smoke, and we're not talking about that. But I'm talking about, you know, you'd see these mamawa, you know, kaimati, they'd be on their kaimatis and flies and everything. What could you possibly advise food vendors to adhere to so that they make sure that we're eating safe food?
For my Muslim brothers and sisters, I want to wish them Eid Karim. I wish him all the best during this time of period. But I also want to tell them to be precautious. I know this is it, and especially when the open of the fast, people would want to, you know, ensure they get something to bite.
Yeah.
And you know, I know everywhere, Mombasa, Nairobi, where we have many Muslims in the northeastern, people also have business at this particular point in time. But we are also telling and asking those businessmen or food handlers that are doing that kind of business, ensure that everything is done in a very hygienic condition. Please ensure that even if it is the kaimati or whatever you're providing for people to eat, it is prepared in a very safe environment, and ensure that people, as the people buy, if it's something that has to be cooked at home, please be part of the passing of the message that ensure that this food is cooked at home. Whatever is eaten at that particular point, I think it is important. I know people have an habit of going touching. Please don't go touching people's food. It is not right. Don't go picking. You know, I know there are the Kaimites and somebody will touch and leave and touch and leave. Ensure that you pick whatever you're picking for yourself, and ensure that we practice good practices at that particular point. So let us be precautious. Let food be covered. Let us not expose it to a lot of contamination, both by dirt and by the environment and by people touching. Let us ensure that as a business person, you take the necessary precaution. Ensure that whatever you're giving people out there will not cause a disease, because you can imagine somebody getting a disease like cholera during this time of Ramadan. It can be very bad.
It can.
And actually you had set your time for this period of fasting, and then you get a disease. It can really draw you back. So we don't want this to happen. We'll ensure that we protect each other from getting this disease.
Yes, I think we've almost exhausted a lot about cholera today. If we adhere to sanitary measures, then we'll definitely escape cholera. Now, just before we part short, ladies and gentlemen, remember that you can send in your questions as we are winding up on our social media platforms. Oh, someone had already asked a question, but we've already answered it. Someone else is already saying, why is it that when we receive heavy rains, the outbreak is so high? Why is it that I get fever? Is fever one of the symptoms of cholera?
Not necessarily. Okay, it is a bacterial infection. You can have fever with a bacterial infection, but it's not one of the major signs that you'd get if you have cholera. Yes.
Oh, okay. So I think we've almost exhausted everything. Just before we wind up, there is that video that we had already started seeing in the beginning about safety measures that we should take. I think there are 4 or 5. Let me see my producer Shakombo there have it on our screens. Yeah, we got that from the World Health Organization page, CDC, giving us measures of just how to maintain food safety. Maybe parting shots before we wind up from Deputy Director?
Well, what I want to tell Nairobians and Kenyans at large, we are having a scenario here, and cholera is an easy disease to control and contain, but it starts with yourself. Please take all precautions to ensure that you do not get sick and your family members do not get sick, and any person that related to you does not get sick. Let us pass the information. Cholera is about awareness, because when people have knowledge, they'll be able to take the necessary precaution measures. The other intervention and prevention way that we are having is there is a vaccine for cholera, and we are asking people to seek this vaccine that will protect you for 2 years. So the vaccine is there. It's oral given. It's just through the mouth, and it will protect you. Okay. The efficacy is around 65–75%. So please, you can visit some of the facilities that are providing this service and also get that vaccine.
These are the same centers that you mentioned earlier?
Some of the centers are not issuing, but I know quite a number of private facilities are issuing. I know Nairobi Hospital, I know Gertrude Hospital, I know quite a number of these hospitals are issuing this vaccine. I know some of them might be out of the reach of some population of Kenyans, but vaccine is available. It is also available for children and below 5 years. So please ensure that we protect ourselves. It is saddening that some countries, last time a case of cholera was identified was in 1890 something, and here we are in 2019. I'm talking about 1880 something, and we're still grappling with cholera. So I think let us take precaution, but let me also emphasize that the vaccine is also for the high-risk population.
Okay.
If you feel you're at risk, please ensure that you take precaution. The other thing, do not eat anywhere. Please be cautious of what you put in your mouth, because what you put in your mouth is what that will cause the disease. Find out whatever you're taking, is it safe before you put it into your mouth. Thank you.
Dr. Nasra?
on the video that we saw, one of the other things that we didn't see was disposal of the fecal matter.
Yes.
And usage of latrines, and building the latrines very close to the water sources, which is very, very important. Because ideally this disease, it is a transmission of fecal oral. So that's one of the things we want to completely prevent. And if you do have diarrhea, get to the hospital.
Yeah.
Yeah, you'd rather go to the hospital if someone tells you it's a simple food poisoning or amoeba than you waiting and then someone passing on at home because of cholera, when it's something that can be treated. Because we have so many patients who come and they say that, oh, it started yesterday, diarrhea, and you go like, why didn't you come sooner, yet you know that there is an issue. You always advise anyone that you know or you know of is having diarrhea, just get to any hospital. Let them do for you the stool test, and then at least you can be comfortable going back home and saying, oh, it's just the amoeba or a food poisoning.
Yeah, we do have communities that are living in remote areas and they possibly only have like 1 or 2 latrines. So what's your advice? Because I do know that the communities, say in the farthest lands down at the south coast, and they don't have toilets at all. They're still defecating in the bushes. What could they do? Just quickly.
When you dig a latrine, it has to be at least quite deep. So it has to be at least 6 meters deep.
36 meters deep.
So roughly around my height.
Okay.
All the way down. And then water source, 30 meters away from a water source. 30 meters around 40 steps. So take your 40 steps and then dig latrine. To be safer even further. So that's even keeping the latrine clean. It's very important, because even if you build one and it's not very clean, when it rains, the water will just carry away the infection. So keeping that latrine as clean as possible. And then there's also cleaning of that latrine with chlorine. So chlorine should be 1 part chlorine, 9 parts water.
Okay.
And that's what you clean your toilets with. Okay. That's very, very safe. So ideally keep hygiene and sanitation very, very important. Burying the stool, when you pass to, just bury it the best way.
Okay.
Yeah.
Thank you very much, Bona Deputy Director for Public Health, Dr. Nasra. Thank you very much. We've learned a lot. And you too, I hope that you have gathered the information. The important thing is to maintain clean, healthy environments and sanitation. Remember tomorrow to join us on the round table with Aisha Khan, and we'll have a very vibrant topic tomorrow, inshallah. See you next week on another Ramadan Synchronized. On Monday, inshallah, we'll have Quran. On Tuesday, we'll have other shows, the Thawabu Dabu Dabu. On Wednesday, we have Rahma Saleh with Wanawake na Ramadhani and Siha Ya Ramadhani today. Do not forget to tune in tomorrow with Aisha Khan. See you next week, inshallah. Ma'asalam. Sawm Maqbool.
Horizon TV, the beacon for the nation.